I want you to understand these warning 27 early signs and symptoms of HIV. Before we do a more in-depth discussion about the signs and symptoms of HIV, it's important to understand that, left untreated, HIV can progress through the following 3 stages, where each group is associated with its symptoms. Stage 1, acute illness. Stage 2, asymptomatic period. Stage 3, advanced infection. Stage 1, acute illness. Stage 1 of HIV can be considered the beginning stage. It's the stage a person enters when they first contract the virus, and it lasts until the body has created antibodies against the virus. Remember, antibodies are basically little bodyguards the immune system creates when exposed to foreign invaders. Somewhere between 66 and 80% of people in stage 1 will experience flu-like symptoms within 2 to 4 weeks of transmission. According to HIV specialist and clinical development managers, these flu-like symptoms can include fever, swollen glands, fatigue, body rash, sore throat, joint pain, diarrhea, headaches, ulcers in the mouth, sores on the genitals, muscle aches, nausea, vomiting, night sweats. Before jumping to the stage number 2, I want you to know this clearly. The reason HIV causes joint and muscle pain is because the infection causes inflammation in the body. When someone has symptoms, their symptoms can last a few days to several weeks. But not everyone who has come into contact with the virus will experience symptoms. It's common for someone to experience no symptoms that would lead them to question whether or not they'd been exposed to HIV. That's why anyone who has these symptoms or thinks they may have contracted HIV should consider scheduling an appointment with a healthcare professional to get tested. You want to know your status as soon as possible, as early treatment is best for preventing future illness or symptoms. Stage 2, asymptomatic stage. Also known as the clinical latency stage, this stage of HIV is known for its lack of symptoms. During this stage, the virus exists and is multiplying in the body and is beginning to weaken the immune system. But it isn't, yet, actively causing symptoms. A person with HIV at this stage may feel and look totally fine. But they can still easily transmit the virus to others. Stage 3, AIDS. It may take years, even decades, but when left untreated, HIV may attack and destroy enough CD4 cells that the body can no longer fight off infection and disease. In short, it breaks down the immune system. Once this happens, HIV will progress to stage 3, often referred to as AIDS. A person at this stage has a severely damaged immune system, making them more susceptible to something called opportunistic infections. Opportunistic infections are conditions that the body would normally be able to fight off but can be harmful to people who have HIV. People living with HIV may notice that they frequently develop colds, flu, and fungal infections. The symptoms someone with stage 3 HIV might experience include nausea, vomiting, persistent diarrhea, chronic fatigue, rapid weight loss, cough, shortness of breath, recurring fever, chills, and night sweats, rashes, sores, or lesions in the mouth or nose, on the genitals, or under the skin, prolonged swelling of the lymph nodes in the armpits, groin, or neck, memory loss, confusion, or neurological disorders. When someone's CD4 count drops below 200, that's when someone becomes susceptible to opportunistic infections like pneumocystis pneumonia. This may all sound pretty scary, but remember that HIV can be managed with medication called antiretroviral therapy. So, that's all for now. Thank you for watching. Subscribe, share and raise thumbs up if you like video.